I wish the Medicaid program paid better rates too. But under this plan, even though a provider might get paid a better rate when the insurance gets around to paying for it, the provider is going to have to try to collect a deductible and a co-payment that the individual just doesn't have the money. And then that will become bad debt. And it won't just be bad debt for hospitals, it'll be bad debt for clinics, for individual therapy providers of various kinds. And then when they figure out that they can't collect, some of them are going to start saying, we won't take those clients. And then pretty soon you'll have a problem in your district where the people that are the sickest and the poorest won't have access to a clinic, won't have access to a doctor at all, because that is the incentive this creates. It cuts what we're providing to the patient by 40% and asks the provider to eat that up front if they will take the patient. That is a bad idea. Today, at least, we're paying costs. I know there are people in the chamber who think that providers are not paid costs because they tell you they aren't. But if you go ask the community clinics who get the same rates from the Medicaid program as other private providers, they'll tell you they're getting paid costs on the people that have payment. What they lose on are the uninsured. And this particular provision that would be restored in this amendment is going to cause 100,000 people to lose their insurance. And then the provider has no payment at all for those individuals when they get sick. So let's not pretend we're making providers better off with this new program, because we're not. We're making providers worse off. You don't take 40% of the money off the table and say providers are going to be better off.